Good afternoon. We will be starting our webinar in 1 minute. Good afternoon. My name is Tess Romaine, and I am the Interim CEO at the Toronto Central Local Health Integration Network. On behalf of the East Toronto Health Partners, welcome to Building an Ontario Health Team for East Toronto webinar, and thank you for joining. Our goal today is to share some information about East Toronto Health Partners and the work we have been doing together, and to answer any questions you have about the partnership. I am pleased to be here today with representatives from the East Toronto Health Partners and to have the opportunity to serve as the moderator for today's discussion. The East Toronto Health Partners have taken many steps to develop a true network across a broad continuum of care. The partners have committed to working differently together in order to explore how local health services could be better coordinated to improve health outcomes, experience, and value. Sharing accountability and building a more integrated system at the local level is not easy, as many of us know, but the impact is significant, and we are encouraged to see they have engaged patients, families, caregivers, and providers to envision an integrated system of healthcare for everyone in East Toronto and for those who seek care there. These partners saw the opportunity to come together to create a better system for patients and families. Building on a strong foundation, the partners have aligned with our overall vision of integrated service delivery, leveraging the opportunity for change in the current healthcare environment. Toronto Central LHIN is working closely with and in support of the innovative and important work taking place by these partners. With that being said, I'd like to start by introducing the panel members who will be leading today's discussion. On our panel today, we have leaders from the anchor organizations of the East Toronto Health Partners and a leader from the East Toronto Family Practice Network. I would like to start by introducing our panelists. Anne Babcock, President and CEO, Woodgreen Community Services. Jennifer Bowman, Vice President, Providence Healthcare. Jason Altenberg, Interim CEO, South Riverdale Community Health Center. Carol Annette, President and CEO, VHA Home Healthcare. Sarah Downey, CEO, Michael Garron Hospital. And Dr. Kevin Workington, Chief of Family Medicine at Michael Garron Hospital, representing the East Toronto Family Practice Network. Before we get started, we would like to encourage you to submit your questions using the question mark button on the webinar panel, and we will do our best to answer as many of them as we can. We would like to start by giving everyone a bit of background on East Toronto Health Partners. I will now turn it over to Anne Babcock from Woodgreen Community Services to get us started.
Thanks, Tess. And welcome everyone to the webinar. We're very excited about the opportunity to be speaking with you today and to share a little bit of what we've been doing and have an opportunity to have questions. The East Toronto Health Partners is an evolving network of health, community care, and social service providers with a long history of delivering East Toronto solutions together. In fact, we solidified our commitment as partners well before the launch of the Ontario Health Team process, with a shared vision and guiding principles established as a result of our shared investment in winter surge planning. In 2018, we signed a letter of intent placing an integrated care model and East Toronto Health System above our own organizational interests. You've already heard who all our partners are, and we have very excited about the work that we've been doing and the engagement process that we've been involved with. As well as the partners that you've heard about, we have a fantastic emerging East Toronto primary care network, which is currently being developed by physicians and will play a critical leadership role in this evolving integrated model of care. And later on in the webinar, you will be hearing more about that. So partnerships are really at the heart of the East Toronto Health Partnership Ontario Health Team. We are dedicated to creating an integrated model of services that places patients, clients, and families at the center of care. It is our intention that all health and community care providers in East Toronto will be involved as we move forward. We envision a network of networks, a model that supports different opportunities for service integration and partnerships across East Toronto. For example, engaged partners are actively involved in the planning, funding, and delivery of specific initiatives, while supporting partners are identified as having an interest in remaining informed and involved. As we grow and evolve, we anticipate fluidity for partners to participate and engage in the partnership in many different ways. Finally, we are really excited to share with you today our defined Year 1 priority populations. We hosted a series of co-design workshops to jointly determine our priority patient populations. These workshops brought together partners, providers, physicians, patients, consumers to better understand the needs of East Toronto community. That work resulted in the identification of 3 priority populations for our Year 1 planning, as well as identified neighborhoods. So as you can see, we will be focusing on seniors and chronic disease, youth wellness and mental health, substance use and addictions, and then finally on 2 priority neighborhoods. We have wide representation at the East Toronto Health Partners planning table through a number of committees that are focused on the better serving our priority populations, as well as committees responsible for the logistics of the application planning and the Ontario Health Team rollout. Now it's my pleasure to introduce Jennifer Bowman, who is going to give you some insight into all of the work we've been doing around engagement.
Thank you, Anne. The importance of engagement is clearly reflected in and guided by East Toronto's guiding principles. So first, we are guided by the needs of communities and the people we serve. What that means is building a system that takes into account and responds to what we hear from community members, respectfully engaging resident patients and communities in a meaningful way, and respecting the diversity of stakeholders, being guided by their voice and maximizing equity. Second, we are committed to learning and continuous improvement. This is an evolving process. The path is not completely crystal clear, and we will need to learn and adjust as we go. Development is evidence-informed and supported with evaluation. And part of that evaluation is finding out how the changes and initiatives impact the people they are meant to benefit. Third, the process is inclusive and transparent. The model is collaborative and participatory, on people coming together on a voluntary basis, looking to engage people through different means because one approach does not work for everyone. So you'll see face-to-face meetings, social media, websites, full-day co-design, and smaller group meetings, among other avenues. We are committed to consistency in how we communicate, providing reliable sources of information that is readily available. Anne began to describe some of our stakeholder groups, and I'll just add a little more to that. So our stakeholder groups include, first of all, patients, clients, caregivers, families, and community members. The voices of the people we serve are foundational to how we proceed in East Toronto, and they have had and will have a number of ways to participate. Engaged partners are providers in East Toronto that are actively involved in the planning, funding, and delivery of East Toronto Health Partner initiatives, and initially focusing on the first-year priorities that Anne described. These partners will be kept informed and have input into the decisions of the partners. They will co-design care pathways focused on improving health collaboratively with their other partners. They will commit resources as needed to the planning and implementation of the care pathways. They will be invited to sign off on and deliver services within specific care pathways. Engaged partners will also be connected through one or more anchor partners and may work with that anchor partner on specific initiatives. Supporting partners remain informed and involved, but they may not be as active in the planning or delivery as the engaged partners. These may be local providers, individual practitioners, faith groups, and others who care about the health of the community and are critical to local planning. It includes agencies that are engaged in the well-being of the communities they serve. These partners may already be engaged through some of our neighborhood care teams. The common factor is a commitment to keeping people as healthy as possible, supporting social determinants of health, and fostering a sense of belonging across strong communities. They will be informed and involved periodically, but not formally committed to joining a planning table. Primary care. Attachment and the relationship of patients to their primary care providers is central to the Ontario Health Team. Kevin will speak to this next, but primary care has been consistently involved in activities to date, with efforts to reach out to community health centers, family health teams, and other practice models, including independent physicians. I'm catching up with the slides now. Community engagement is paramount to our success. As you can see, we've hosted a number of engagement sessions to date, starting with a large kickoff that was hosted by KPMG in the spring. What's especially amazing is the level of engagement that has happened over the summer months. Our work has been focused on our year one priorities: youth mental health, substance use and addictions, and seniors with chronic disease. Those stakeholders most directly related to the priority groups have been the primary participants in many of the activities noted. Without going into detail on each event that we've hosted, because that could take all afternoon, I'll just reiterate that stakeholders have actively come together to set priorities and begin the planning to create the Ontario Health Team and to initiate plans to improve services for the target populations. We have been documenting the outcomes of these events to help inform and populate our full application to the ministry. And most importantly, the activities to date have set the precedent for the future, demonstrating the value of engagement in creating the healthcare model of the future.
Thank you, Jennifer. I would now like to ask Dr. Kevin Workington to speak briefly about the involvement of primary care and the development of the East Toronto Family Practice Network.
Thank you, Tess. It's my pleasure to be here today as we work to do what we can in the evolution of healthcare in our neighborhood, to work together and to combine forces and expertise. You know, the East Toronto Family Practice Network has similar origins to the East Toronto Health Partnership, in that it was alive and well prior to the notion of OHT's coming of age, and I would argue that it would still continue, or if it didn't, it should, even if OHTs were no longer a thing. What we know from evidence across the world is that when primary care is engaged and has a strong, coordinated, and central voice in how healthcare is delivered in a community, that the communities thrive. And the services that are there to keep people healthy and safe are best served. So in a grassroots sort of way, a group of inclined physicians came together and decided to organize in a very deliberate and formal way. We don't pretend to, at this present time, represent the interests of the 260 family doctors operating in East Toronto, nor the primary health care needs of the approximate 300,000 people who live in our catchment, but ideally we would like to. And the reason is simple and already stated. We know what our patients need in order to stay well, and we have a lot to offer. Our purpose in organizing is just to have that strong voice and to participate in a way that will help not only guide, but lead healthcare transformation in the era of Ontario Health Teams. Why should you participate? Well, to join voice. You have much to offer, and the more of us together, the stronger we'll be. In the organization of the East Toronto Family Practice Network, we have an interim board, we have an interim executive, and we probably represent 150 of the physicians of the 260 I spoke about, and are participating in the care of approximately 200,000 of the 300,000 patients that I spoke of. How do you get involved? How can we hear your voice? You can go to our website, East Toronto Family Practice Network. There are ways to support us in spirit or more deliberately via letter, which you can download, sign, and send back to us. In very short order, we'll be having additional information sessions in October. The website has that information. We look forward to hearing from all of our family practice colleagues in the community, so that we can, with this fine group of very well-intentioned and hardworking people, form an OHT second to none, the example of how Ontario health teams can serve a particular population. Thank you.
Great, thank you, Kevin. This is now the time that we are going to open it up for questions. And so I'm going to remind folks who are participating on the webinar that you can click on the question mark button on the side and submit any questions that you would like to submit. And so I am going to first speak to a question that we have received. To the group, will you be hosting future community engagement sessions at alternative times? It's difficult for family physicians and frontline providers to participate during the day.
Thanks for the question. It's Jason Altenberg speaking. So this is an excellent point and not lost on us at all, and we appreciate the question coming forward. We also really appreciate how busy people's schedules are, particularly during a weekday afternoon, especially when so many of our partners are focused on delivering frontline care to our communities. And we want to assure everyone and all of our partners, and recognizing that the people that maybe asked this question sadly aren't able to hear this response directly. So for those of you that can, please pass this on, that this is just one of many opportunities to engage and consult with the community as we work toward becoming an OHT. We will certainly host future webinars and engagement sessions, and we heard from folks that selecting different times of day or offering multiple time slots would be helpful for everyone to be able to fully participate. And we really do appreciate this feedback. And thank you to those who could take the time out of their schedules to be with us today. We are committed to doing what we can to make sure everybody can fully participate, and look forward to the rest of today's conversation and questions.
Great, thank you. Before I go to the second question, I just want to remind folks that we will be sharing the links and information on this webinar, including a recording of this webinar and the links that Dr. Workington just referred to, so that if you'd like to participate, you can click on those links. So that will be shared following. We have a second question. With the new Ontario Health Team model, will patients have access to their health information? Sarah, over to you.
Thanks. So the East Toronto Health Partners does have a digital action plan and a digital subcommittee trying to get answers to that very question. We've identified a few priorities already, including, for instance, the ability for providers to be able to securely message between and among them to ensure that the care that they will collectively provide to patients or clients is secure and safe. We recently had a vendor day on Friday, September 13th, where 18 vendors came and profiled the kinds of software solutions that they have in order to provide both information to providers about common groups of patients, but also to patients or clients themselves. And while no firm solution is in place, I can assure people that finding a digital solution to provide timely and accurate and comprehensive information to patients, clients, and health providers is on our radar.
Great, thank you. We have a third question. It's a question from a family practice provider. I'm in a group solo practice. There's a three-part question, Kevin, so be prepared. How will I benefit from the East Toronto Health Partners? What will it cost me? And will this affect the days, times that I have to work?
Okay, I think the simple answer to that question is we are not creating the delivery of primary care as exists by family doctors. Our goal is not to become an arm or an agent unto itself separate from the OMA. The OMA is still our negotiating body, and the people will be practicing the way they have always practiced, hopefully in a more coordinated way and with more resources. So it'll cost you nothing. It'll affect in no way how you work. And in terms of the benefit of participating, I think it's like any change. The more voices that are present at the table where change is taking place, the better the ultimate evolution will be.
Great, thank you. We have a next question, and it is regarding the governance model for the East Toronto Health Partnership. What is going in the application re-governance? Carol,
so it's Carol. I'll take a first stab and my colleagues can add as they wish. So what's going in, we're excited. I would say we've created what I call is a getting started governance framework. And we've actually crafted a joint venture agreement for the anchor partners and hopefully our primary care network as it's being formed. And it has the typical ingredients of a venture agreement, everything from dispute resolution, how decisions will get made, but you name it, you have seen it on all the templates that the resource group has provided. So as I say, the exciting thing for us is getting something down in writing that we can be committed to and use as our sort of template going forward. But I will underline it's getting started because we don't know what we don't know. And part of it will be to continue to refine it and figure out what we want it to contain. It also includes some appendices that we'll have to fill in. Sarah just mentioned the digital health strategy work. It will also include many different, what I would call arrangements with our collaborating engaged partners as we enter into specific programs and initiatives. So it is definitely a great work in progress.
Great, thank you. Just a reminder to participants that you can click on the question mark button to ask a question, and we encourage you to do so. Also wanted to remind folks that the slides from this webinar will be posted on our anchor partners websites. We have another question, and it is, what is your vision for offering specialized services in the Ontario Health Team?
Again, I don't think we have a specific vision on this, but simply to say the hospital, which is an organization full of medical specialists, is very much a partner at the East Toronto Health Partner table. And we certainly have a number of specialists involved and engaged in designing services within the 4 priority populations. Perhaps an example of where we've used specialists in this process is a program we've recently launched with our partners at VHA Home Healthcare in Wood Green, which is a Home Today program, which we call Home Today, which is a program that sees the discharge of certain COPD, chronic obstructive pulmonary disease patients from hospital after 2 or 3 days of hospitalization with enhanced services at home to keep them well and try to prevent readmission. Specialists in the hospital are in contact, obviously, with the patient at home in order to ensure their care is effectively managed, even though they're not in the hospital. We have specialists involved in the youth mental health initiative as well. So really a lot of our focus has been about getting healthcare services out to where people need them. And that certainly includes in many pockets the engagement and presence of specialists in co-designing that system with other partners in the healthcare system.
Great, thank you. We have another question regarding mental health. How will primary care providers link to community mental health services?
Part of the plan, and this would mean a lot to physicians working in our catchment, is to continue the fine work of SCOPE, which is a way of coordinating access to specialty care for busy primary care practitioners. And right now, it involves internal medicine, and it also involves radiology. And in the program, there is a central coordinating number and a central coordinator who gets access for family doctors and their patients in a timely and appropriate way. We hope to use that platform going forward with access to many other specialties, and the very next thing on the list of scope to engage is primary mental health care and the specialty resources that are available around that.
Thank you, Dr. Workington. I'll also just, for those who don't know the acronym SCOPE, it's Seamless Care Optimizing Patient Experience.
Not the mouthwash.
Not the mouthwash. Thank you. The second question is, or another question is, will EMRs be shared with service providers to ensure seamless transitions? Electronic medical records.
There are a number of provincial initiatives underway with the goal of sharing and integrating, it's Sarah Downing, by the way, with the goal of sharing health information across the continuum of care. We're planning this with vendors, trying to make sure that we're not going to violate privacy laws as they currently exist in order to do that. As I said earlier, there is a digital committee that is at least sussing out types of vendors and products that we can use, staying abreast of the privacy issues as they exist currently. And I'm sure if we feel the privacy laws are a barrier to sharing information, then we'll certainly advocate with many others, I'm sure, who are going through this process and realizing the same how we do that. What I do know is that all these Toronto Health partners are highly informatics based. They all have their own software or product. Many of the family doctors in East Toronto would be in the same position. And I think part of the solution might be an integration solution that pulls together our information that is housed currently in our individual organizations to create a full picture for our patients.
Thank you, Sarah. Next question is, what is the role of engaged partners in the governance model? And I think to that I'm going to turn to Carol.
Yes. Thanks, Tess. So I think at this point, the role is critical because we need our engaged partners at all the tables that we have formed around our priority year one populations. So they are engaged in making the decisions about how we are going to serve those populations, how we are going to reconfigure ourselves to do a better job. And from my perspective, then they are decision makers at the level where it matters for our clients and families and providers. And I think we will still be figuring out how various tables, report structurally into the leadership table, but that is part of this unfolding, or the word we've been using all afternoon, evolving process.
Thank you, Carol. Next question to Kevin, I believe. How do you see physiotherapists and chiropractors fitting into the system?
Okay. Well, it's very clear that providing good health care is a team effort. I would extend physios and chiropractors to include all of our professional colleagues in dietary science, in chiropody, in social work, in nursing, in nurse practitioners. And I think it's hard to see how this will all evolve. I think our hope, of course, because what we want to build is the best system for health and access, that the fully mature OHT would have seamless and available access to specialties like physiotherapy and like chiropractic for our patients who would most benefit, and in a timely and appropriate way. that doesn't really answer the question, I know, but the plan is to certainly build on the very clear knowledge that it takes a team.
Great, thank you for that. We have another question, sort of follow up on the digital health one. Is the digital health strategy just for year one or beyond year one as well?
At the moment, the digital health strategy is focused on October 9th, which is the submission date for the OHT. We're coming up with our own ideas and priorities within East Toronto around the digital health strategy, and it's certainly more short-term focus than it is long-term. We don't have a lot of control over the long-term vision for this, but our real hope is that we'll be able to work with the government and across Ontario health teams to come up with common digital solutions that facilitate the creation of integrated care delivery for patients across Ontario.
Thank you, Sarah. Next question. Is there a steering committee or a project team that I can contact for more information? I represent a supporting partner and want to know more. Jason Alsworth?
Sure. So there is a way to get more involved, and I would say that we're open to hearing from any partner directly and if they want to express interest in being more involved in a particular population stream or work, and would just suggest that maybe as a direct point person, and Wojtek is the interim project lead for the partners as one resource, but certainly any of us would be open to hearing from a partner who wants to be more involved, and we'll make sure that in the communication that goes out, there's a way to connect directly.
Great, thank you. Another question, and I'm going to read as it was written. Have not heard much about co-creating with patients and caregivers. Seems as though the team is working for patients rather than with them. And Babka?
Yes, hi, thanks, Tess. I don't think we've had a lot of time to delve into some of the engagement processes that we've undertaken, and I think we had a nice long list there, but we certainly couldn't go through each one of them. So just as an example to let you know, when we were working on the Youth Wellness Center as a model, we held a full day engagement session we had about 50 youth who participated in that, as well as another 30 providers. Since that day, we've done some asset mapping, again, with youth and providers. And again, we've now formed a youth advisory group who are continuing to work on that Youth Wellness Center. And that's the same model that we've used in all of our priority population work.
And if I could it's Jennifer, if I could just add to that, we do also have a group of patients, caregivers, family members who are providing some advice to us on how best to involve that group in all of the activities that are underway, how to best facilitate the participation in working groups, in the governance, the leadership team, and that group's met a couple of times, is planning on meeting again. So they're providing us direct advice on where they can provide or the most value, how they can feel most involved, and what are the ways in which we can facilitate that participation.
Maybe I'll just add, it's Tess from the Lynn here, is that we also, as part of supporting the great work that you're doing in terms of building and building the vision, is that we've shared a lot of engagement that has been completed over the last few years, and much of that has been captured and shared, so it's not starting from a brand new perspective, but actually building on a lot of the great engagement that was done with many partners who are probably participating at this point. So going back to my MC role here for a moment, or moderator, here's another question that we have. What is the future for multiple existing boards and client committees throughout the network? And I believe Jason is going to take this one.
So it's clear that in our vision for this joint venture, independent organizations and boards will remain independent, and in fact, in the early stages of the OHT model, it's clear that we're not looking to change board governance for any of the partners. Similarly, organizations will continue to work with their existing advisories, client advisories, but also add opportunities to advise our population work as an OHT. But that doesn't in any way suggest replacing existing community patient and family advisories that exist.
Thank you. We have another question. Why is each Ontario Health team having to resource their own digital solutions? This doesn't seem cost effective and in fact could splinter digital initiatives in the province. Over to you, Sarah.
Thanks. We're getting a lot of good questions about digital health. So I don't think that let me start by saying the Ontario Health Team environment is a low rules environment. And while the government is certainly trying to support us through things like the digital playbook, no major resource investment decisions have been made by the province in this area, this one that I've become aware of. I would say in the East Toronto Health Partners discussion, we haven't contemplated major investments in any solution. What we're trying to do is figure out within the systems we have and the priority patients we have, how best to link information to help in the delivery of health care for everybody. And so, I suspect that when the government gets its 31 applications for full OHT status back on October 9th, they may look through our digital health solutions to see what kinds of ideas or strategies we have as individual OHTs. And I would love to think that they'd make some investments to make this easier, but just for the time being, all we're trying to do is within the systems and frameworks and providers we have currently, how can we optimize what we have already invested in order to find some quick solutions.
Thank you, Sarah. I would also add again, Tuss, that we have a Digital Health Advisory Council that is set up to support the discussions underway, and one of the elements that have come from that is that question of how the OHTs can continue to learn from each other and however we can continue to support that going forward. The next question is if you could please give more information regarding hospital and long-term care plans, and over to Jennifer.
I'll start with the long-term care side of things. So there are some things that are not yet 100% clear around long-term care, about, for example, what the process of admissions will be and how that might change. But what we do know about long-term care is it interacts with the healthcare system in a number of ways. For example, what happens in long-term care can affect people's ability to be cared for at home. It affects emergency room visits. So long-term care is a critical part of the healthcare system. And just recently, we've sent out an invitation to long-term care homes that are in our area to come together to have a little bit of a discussion to talk about what role long-term care could play in this while we're waiting for some of the components to become more clear.
Thank you. That's great. The next question. What will be done to create governance structures to provide engaged partners with the assurance that the anchor partners in the joint venture are not in a position to make decisions based on their own institutional self-interest, given the long-term goal of integrating funding into one envelope?
So it's Carol, and I seem to be getting the governance questions. It's interesting. As the system changes, it does bring out, I think, the best and sometimes the worst of some people. And I can only assure you that those of us who have been in this community, East Toronto, for many, many years, are very much about putting the interests of our clients and families front and center, as we've said. And that is who we're interested in. It's hard not to muddy your organization because that's what you're from and where your roots are. But I feel confident that all of us here today have really set the self-interest aside and tried to think what's best for community. And I'll tell you, it isn't easy. I agree. And I think our goal will be to ensure that everyone has the same guiding vision and principles that will tie us together, and that will be our engaged partners too. And I'm stumbling on my words because I honestly don't know how to answer that other than to say maybe someone will help me. We're committed.
And this is Ann Babcock. The other thing I think we've demonstrated with very recently and last year with our surge dollars, the hospital was very generous and had a lot of foresight to bring the community together to say how can we prevent surge in the hospital by working with our community members. This year we've done that again. We brought probably 3 times as many people together to have that discussion, and the projects that are being that we have looked at and that we will be funding are far broader than the 5 agencies that are sitting as anchors.
And it's Sarah, and I guess over time, I mean, we haven't had indication yet that all the funding for health services in East Toronto will be consolidated yet, though it's part of the long-term vision. And I would quite suspect that should that ever come to be the case, there'd be some system-level governance established that would ensure that, in fact, the funds are maximizing the health of people and for the geography for which it's assigned. So in the short term, you know, we, through initiatives like this and by publishing our self-assessment, and we will publish our full application in our joint venture agreement, we're trying to be clear that we're doing our best within the low rules environment of establishing some rules and patterns for engagement. And our own commitment is to be as transparent as we can in how and where we choose to pool resources and allocate resources for a common good.
Thank you. We have a next question. What are the geographical boundaries for the East Toronto Health Partners Ontario Health Team?
Who has a map?
So roughly speaking, they are sort of east of the Don River, south of Eglinton, west of Warden, down to the lake. And that represents a catchment area of probably 350,000 people. And those are largely where we've gone out and sought partnership and engagement directly. And so that's been kind of our area of focus currently. And that includes Thorncliffe and Flemington as neighborhoods that are just slightly north of that, but very much tied into the East Toronto healthcare ecosystem.
And again, we are happy to share that information in the links that we'll be posting each of the anchor partners will be posting. I have another question. Excuse me. How can I learn more and engage on the priority populations for year 1? Specifically, I'm interested in youth mental health as I look towards and back.
Thanks again, Tess. If you're very interested in youth mental health, please feel free to reach out to me. My email address will be available. I will link you into the committee that's been working on this. Happy to have as many people who have the interest and passion to work on this to be at the table.
Thank you. We have another question. How do the 5 anchor partner organizations decide to come together as an Ontario Health Team applicant? Who'd like to take that one?
So it's Sarah Downey. Why don't I start? For starters, many of our organizations have long histories of serving the East Toronto community. The hospital's 90 years old. Wood Green must be at least 80. South Riverdale is 40 or 50, 43. And we've had a long-standing collaboration with many family doctors in East Toronto. And so there is a natural affinity for many health service providers that are there that predates this government's agenda and the last government's agenda, period. We quite deliberately came together. Susan Fitzpatrick, when she was CEO of the Toronto Central LHIN, invited a representative from each of the major health sectors to a table to discuss the possibility of better integrating health services. Integration of health services, truthfully, has been the priority of many governments, no matter what their political stripe. And so we came together, given our history of collaboration, which is long and deep, to see was there anything we could do in a more accelerated way together. And so, in fact, when Susan was at the LHIN, she invited us to a table. The table still exists, and is chaired by Dr. Stanley Brown, who's the Dean of the Dalla Lana School of Public Health, who's been our facilitator to come up with ideas and strategies and vision for how this could get started. So we, as a group of anchor partners, has been meeting together for over 2 years, at least on a monthly basis, and I would say over time it's weekly now, and our teams are getting together on a very frequent basis. And I would say work of creating an integrated system or the outputs that we anticipate for these Toronto Health Partners has certainly become very much a daily priority for me personally, and I'm sure it is as well for my anchor partner CEOs.
Thank you, Sarah. Next question. How will funding be determined? I think, Carol, you're going to take this one.
I will, but we may need to ask other folks, but beyond this table, that might be our ministry friends and colleagues. But certainly through our proposed joint venture agreement, the partners have committed to a joint financial accountability framework. So it will be focused on common funding, shared opportunities for savings, reinvesting those savings to enhance care. But that's really long-term out. Right now, I think what you have is a lot of goodwill and people donating resources, finding dollars where they can, similar to the surge funding. So that's long thinking, but we built in that framework to sit there as we move forward. So in a future state, and this was a previous question, we believe the teams, Ontario Health teams, will be funded through an integrated funding envelope based on the care needs of our attributed patient populations. And the idea really is to determine how to best allocate resources. It is a finite pool of resources to create the largest, greater good for the East Toronto community. It is still an unknown who would hold that envelope, how that envelope would get to us, but we're open to working with partners differently than we have in the past to improve how we work.
Thank you, Carol. I will just remind everyone participating that the relevant contact information and the full slide deck, as well as links referenced, will be made available on all anchor partner websites following this presentation. So the next question is from a resident, obviously. What changes can I expect in my health and community support services? Jason?
So, as has been said, we're trying to build a truly connected system. And as has been said, the group of partners around this table and our engaged partners have been doing this work under different mandates and different governments and attempting to improve things for decades. So we know that despite those efforts, that the healthcare system is still complex, confusing, and hard to navigate, especially when you don't really know what all the resources are available to you, whether that's as a community member using care or even a provider. And we know that the hardest points of pain for people in the system are transitions between providers or between different parts of the system. We know that people are frustrated and struggle with long waits for care, duplication of telling your story over and over again, whether that's through forms or sitting in a room with somebody. And we are really trying to build a deeply connected system where that kind of duplication doesn't exist anymore, where care is actually coordinated, where we can more easily and fluidly really share information so you don't have to tell your story over and over again, and that the care you get is the right care for the right time and is really multidisciplinary and interprofessional. So we know it's going to take time to get there, but our commitment is to keep working with you to get to that solution.
Thank you, Jason. Great. Next question. How can community agencies, such as the John Howard Society, be involved? Really just understanding whether it would be via referrals, that they would be supporting the OHTs, and want to understand how these, understanding how this will affect clients, or how clients will be affected by these changes.
Okay, Sam Babcock. I think when we look at Ontario Health Teams, really what we're looking at is trying to develop, and I think we've said this a few times, but an integrated health system. And so hopefully the impact on your clients is that they have access to services, they have access to medical care, they have access to their needs being met in an easier and a better way. And so as we move forward as organizations looking at not standalone siloed health, but integrated system planning, organizations that may not normally consider themselves part of the health system will in fact be part of that process. So you will want to know how your clients get access, and what will change is hopefully just an access system and a support system that is improved over the one we have now.
Great, thank you. Yes, Jason, please do.
Just want to offer too, for the folks at John Howard who maybe haven't connected, there may be some natural population stream work to connect to, and I'd invite them to reach out around the substance use and health stream. EFRI and others doing similar work have connected through that stream to help us with the visioning and planning. If they wanted that connection, they could reach out to me directly.
Great, thank you. Next question I think I'll take. It's with regards to funding. Will there be any funding changes for the next fiscal year? I'm not sure anyone here could answer that. I can't answer that either. So I would just say that obviously we're continuing along the process that we have, and as we hear more from government in terms of future funding changes, we will be sure to advise that, but nothing at this point. The next question is, how does this affect clients' ability to access services in other areas? For instance, if a client in Thorncliffe Park wishes to go to Sunnybrook, which is in the north area, are there restrictions?
So it's Sarah Downey from Michael Garron Hospital. No, nothing restricts patients and clients and family members from getting services anywhere in Ontario. I think all we're doing here is working with local agencies and or large organizations that have a focus in East Toronto, where we know there's a large catchment area and people tend to access service in East Toronto, to try to help them organize it. I know that North Toronto, which includes Sunnybrook, is working in a similar way to try to integrate services there, and certainly the area around North York is also working hard on their OHT application. So I think over time it'll just be easier for anybody trying to seek access to services in another part of the city to know where and how to access those for people if the service is more appropriate for them.
Thank you, Sarah. We only have time for 1 to 2 more questions, so I would just highlight that any questions that we don't get to on the webinar, we will be able to share an FAQ after Q&A with you. So for those who didn't have their questions read, please note that we will be providing answers to those questions going forward. So the next question is, what is the plan for branding and communications throughout the communities to help people understand how and where to get these services? Carolina.
Thanks, Jess. Well, first of all, because we have a fabulous communications team from all our organizations who have pitched in and are doing a brilliant job in 1,001 different ways. So I would say they're going to help us ensure we have a clear brand and that we communicate, and I'll say this, in probably 1,001 different ways, because one way does not suit everybody. We talked today about this time wasn't a great time for webinars for everybody, so we're going to do it through all kinds of different medium and methods and shout out. And if you have any suggestions that would help us in this way, we'd be happy to take them. But I think we know that without communication and open transparency, doesn't matter what we do, we need to engage everybody. So thank heavens we have a great communications team.
And maybe I can add a bit to that excellent answer from Carol. I think when it comes to patients and families, I don't know that the concept of East Toronto Health Partners is relevant yet, or I don't know what it will be in the future. I think what will be really important is that when they require different kinds of services, that is really seamless to them. And when they've shown up in their family doctor's office and they need help with housing or help with income or help with drugs or whatever it is, that there is actually an easier path for their doctor to get them those services. Or if you know your mother requires services at home to help manage a chronic illness, that is just immensely easier than what it is today. And so even in our own organizations, we certainly refer to organizations as part of the East Toronto Health Partners, and we haven't totally branded that or put a logo to it. But I think what we may see over time is our organizations affiliating with the concept of an East Toronto Health Partners. It's not a legal corporation. And who knows if it'll ever be one, but it may be, but it'll be almost organization and linkages to the brand of East Toronto Health Partners.
Great. Thank you very much, Sarah. We have a question, probably I will turn to one of Anne or Jason, but does the plan include keeping centralized intake for community mental health?
Good question. At this point, we haven't really gone down the road as to what changes to the system will be happening in order to make it a better and more integrated approach. However, centralized access is really key for our system to work better. So I can't imagine at this point in time that we'll be tackling a change to that system, but maybe we'll be building off that system.
Just to add to that, it's Jason. One thing for all of our population streams that we've visioned is 24/7 access to meaningful system navigation within the system. And so, as Anne says, that builds on the notion of a centralized intake process and hopefully creates improvements, but doesn't replace that idea.
Great. We are almost out of time, so we're going to need to conclude the questions there. I'd like to turn it over to Carol Annette to provide some closing remarks.
Thanks, Tess. So first of all, thank you to all of you for joining us today and your great questions. And I hope you didn't feel that sometimes we didn't have the answers you wanted, and partly I'm going to underline because this is very much a work in progress. Many things are not carved in stone. There's a lot of exciting initiatives going on in East Toronto. But there's lots more to come. So thank you for taking that time, and I really encourage you to keep the conversation going and ask any one of us anything, and we'll get to contact. This is the first of a webinar that we hope to do more of, to keep people open and interested and wanting to know and having a dialogue. So this is great. I want to thank the folks who put this together for us. That was super. And to all our partners who may be listening, who have been engaged to date, who've been part of our priority populations and our surge work. It has been really remarkable to see the energy and the excitement in the rooms as we build our healthy community together is really how I see it, and a much healthier one. And I think Kevin might have said it earlier on this webinar, but we're really looking for as many voices as possible. We need people to speak up. We need people to tell us what matters to them most and how we can do that together. So I think that's probably it. I could say thank you a whole bunch more times, but you'll get everything coming out to you. And we'll be in touch soon. And wish us well for that October 9th deadline that is looming, and it's all great.
Thank you all. Just as another reminder, we will be sharing the contact information and the full slide deck, including links, through the Anchor Partner website. So again, thank you to Carol Annette from VHA, Jennifer Bowman, Providence, Jason Altenberg from South Riverdale Community Health Center, and Bob Babcock from Wood Green, Sarah Downey and Dr. Kevin Workington from Michael Garron Hospital. Thank you all. Have a good day.